Hello, I'm Dr. Glenn Sterling. I'm the Medical Director of bulkbillivf.com.au. This is an introductory video just to explain to you why we've set up the IVF Bulk Bill website and to invite you to sort of partake in the program. IVF is an expensive treatment to undergo. Thank God in this country that the federal government funds the majority of our IVF program, including drugs and treatment. The global fee that is charged is generally for costs involved with our science rather than necessarily the clinical treatment that you receive. I'm from a background of parents that were teachers that struggled with 4 kids, and subsequently I see a lot of people that simply aren't able to afford IVF, and so as a result of that I've set up bulkbillivf.com.au. The idea behind this website and this treatment arm of our clinic is that people can get access to IVF that otherwise wouldn't have the choice. Some important differences between our main clinic and bulkbillivf.com.au is that the treatment protocols for our bulk bill side of the business is very, very similar for every patient. We give a standard protocol, we give a standard freezing protocol, and when patients come to have their embryo transfer, only one embryo is returned back into the uterus at any one time. This is within good standards of treatment, and we agreed when we set up this side of the clinic that under no circumstances would we allow the standard of scientific care that you receive suffer. Within Brisbane at least, there are a couple of clinics that have set up that stimulate people with a minimum dose of drug. In fact, doses of drug that are so low, it almost seems unconscionable to me. And then when their eggs are collected and embryos are created, rather than freezing embryos, then your embryos are either used or discarded. Otherwise, huge fees come into effect with regards to freezing of embryos. The great benefit of our clinic is that, yes, you will not get the individualized treatment that our main clinic gets, nor will there be any particular protocol that might be individually designed for you, but you will be allowed to have access to a standard protocol that involves good science with really good outcomes with freezing of embryos. There are many clinics around the place around the world that are anticipating going to all frozen cycles. We have not compromised any standards in terms of scientific or clinical care with our bulk bill IVF clinic, but you will notice a significant difference between the individualisation of the treatment in our main clinic compared to the treatment that you may receive through bulkbillivf.com.au. I hope this has been of some benefit to you to understand the difference between the two arms of our business. I hope that we can help those that would otherwise not be able to afford to do IVF have an opportunity to create a family, and they can avail themselves to the power of science within one of the best IVF clinics, laboratories in Australia. I wish you all the best, and I hope we see you at our clinic. Goodbye.